General anesthesia is a temporary and reversible state of unconsciousness caused by the administration of some anesthetic drugs that allow the patient not to feel pain during surgery. In the last video, which you can find by clicking above, we have seen in detail how general anesthesia works. But what if you wake up during an operation? The media often carry reports of people who have awakened on the operating table. But is it really possible? Imagine being completely paralyzed in the operating room and not being able to let anyone know that you are actually conscious. You are unable to move or even speak. You have a tube in your throat that pumps air to ventilate you because you can't even breathe having paralyzed muscles. You hear all the noises, the smells, the pressure of the scalpel blade on the tissues. The eyelids are lowered. No one notices your presence, and you would just like to scream to stop, but you cannot. This is how accidental awareness during general anesthesia is described, often referred to as conscious anesthesia. This is an extremely rare event that occurs in 0.1/0.2% of cases, in which the patient can accidentally become aware during surgery. How do you know if a patient is conscious or not during general anesthesia? In the past, doctors only relied on visual cues to understand how deep the anesthesia was, while now they also relied on other parameters, such as the concentration in the blood of the anesthetic gas administered and the use of latest generation equipment. Over the past decade, several monitoring systems have developed to assess the depth of anesthesia. There are several commercially available monitors that, among new technologies, include bispectral index monitoring and entropy monitoring. The first is due to the acquisition of real-time data from the patient's electroencephalogram, the electrical activity of the brain, which are then translated into a numerical scale that measures the state of consciousness. The result will be a number between 0 and 100 and is important because it provides the anesthetist with a direct measurement of the sedative effects on the patient's brain and thus on how deep the anesthesia is. A value of 100 indicates that the subject is fully awake, while a value of 0 indicates the total absence of brain activity. General anesthesia is usually indicated by a number between 60 and 40, although it can vary depending on the machinery used. The technologies just mentioned reduce the incidence of the risk of intraoperative awakening in adults up to 80% in the case of the bispectral index, but leaving a small percentage of probability of experiencing conscious anesthesia. Not only that, these medical devices are not used as ordinary practice on all patients undergoing general anesthesia. It is the individual doctor who, based on the patient, will decide whether or not to use brain function monitoring. Where these monitoring devices are not used, it is more difficult to determine with certainty the presence or absence of consciousness of an individual. It is a complex brain function whose mechanisms are not yet fully understood and are still being studied today. A person may appear completely asleep but have a minimal level of consciousness. During general anesthesia, not only drugs that turn off consciousness are administered, but also those that paralyze the muscles and prevent reflexes. However, if the anesthetic does not work as it should and the patient becomes aware, he will not be able in any way to communicate it to the operating room staff. What do you feel during intraoperative awakening? Most people who have experienced episodes of conscious anesthesia remember moments of panic and terror which lasted less than 5 minutes, but that in a situation of this kind, they are an eternity. Other people, on the other hand, also report having experienced pain following intubation or surgery. Intraoperative awareness is manifested by a variety of symptoms, including hear noises or conversation in the operating room and remember the details of the operation. The most common sensations reported during awakening are suffocation, paralysis, hallucinations, and a feeling of being on the verge of death. Patients who have had episodes of conscious anesthesia can develop post-operative psychological disorders, ranging from mild anxiety to post-traumatic stress disorder, a chronic and debilitating disorder that can develop due to exposure to a traumatic event. The patient may be afraid to go to sleep because the lying position evokes the trauma of those moments spent in the operating room. Other consequences include mental and physical stress, flashbacks, and recurring nightmares. What are the causes of awakening during anesthesia? The most likely cause of awakening is when the patient is not given the right dose of anesthetic, especially during emergency interventions or in urgent caesareans, where an excessive dose of anesthetic could harm the unborn child. In other cases, the cause could be a human error or a failure of the machinery that deals with the regulation of the anesthetic. To minimize episodes of conscious anesthesia, smaller amounts of paralyzing drugs can be used during surgery, which are responsible for the patient's immobility. In this way, if the patient wakes up, he could move in response to painful stimuli and thus communicate to the medical staff that the dose of anesthetic administered is inadequate. According to some studies, another cause of conscious anesthesia may be the genetic predisposition of some individuals and belonging to some categories most at risk, such as the obese, patients who use extensive analgesics, elderly people, frail people, such as those with cardiovascular problems, and those who daily consume alcohol and opiates. Some patients may be more resistant to the effects of anesthetics than others, or there may be genetic variations that cause differences in the rate at which patients metabolize anesthetics. However, general anesthesia remains a safe procedure, but not free from possible side effects, including the death of the patient. It is an event even rarer than intraoperative awareness and is estimated in one case in 100,000.